Hi everyone. Our last part of secondary assessment is going to discuss shock. Okay. Remember we kind of skipped around on our slides, so if you can go to your slideshow, go all the way down, and we are going to start on, looks like slide 41. Okay, 41. So I know we've briefly talked about shock in the last couple of days, and I keep telling you guys that it's your body shutting down, okay? But we're kind of going to go a little bit more in depth, okay? Look for some signs and symptoms, why our body goes into shock, and we're going to go from there. All right, our slides say shock is a condition in which there is inadequate blood and or oxygen to our vital organs, okay? I know we've already talked a lot about our vital organs, but these five that are listed here, brain, heart, lungs, liver, and kidneys, need to have a constant supply of blood and oxygen. And once that oxygen supply is cut off or decreased, that's when we start to have problems, okay? These are the main vital organs that we have in our body. So when an athlete or any victim becomes seriously injured, like we talked about in our basis of tissue chapter, we have an increase of blood flow to our internal organs. Okay, they want to protect those. We have less blood going to our arms and our legs. This is kind of one of the reasons why they always tell you not to. Sorry, just had somebody walk in. But that's one of the reasons why your mom tells you don't go swimming after you eat, and that's because all your blood is in your digestive system, in your stomach. It's trying to digest your food, and so there's less blood in your arms and legs to help allow you to swim, and you'll end up drowning. Okay, but this whole process is designed to keep blood in our vital organs because that's what we have to do to survive. So one of the reasons why somebody goes into shock is the blood vessels in the head, chest, and abdomen enlarge, okay? So they get bigger, all right? Because they're getting ready for that blood supply. They're getting ready. They know that we have this injury. They're expecting that increase in blood flow. However, there's sometimes there is not enough blood getting to those vessels. Okay, and that can be from several different things. That could be if you have an open wound and you have blood that's leaving your body, there's not enough blood going to those internal organs. Okay. But basically, those arteries open up expecting all this new blood to come, and it just doesn't ever make it. Another reason why somebody would go into shock is that their heart has stopped, okay? If your heart stops, then there's not going to be blood pumping to all the different parts of your body, so those internal organs, again, are not getting that blood or oxygen, okay? This is where we would use that AED and start those CPRs. The last reason that we'll talk about is if there's a significant amount of blood loss. So when we have our major injuries, where we have open wounds that are causing blood to rush out of the body. Remember, we only have 6 quarts of it. This is where we end up getting victims with shock, okay? There are tons and tons and tons of more reasons why somebody would go into shock. These are just listing a few, okay? So some signs of shock. Remember, signs are something that you as a first responder can see on the victim. Agitation, easily aggravated, something that maybe is very different from where their normal personality is, okay? You can see the rapid and weak pulse. So rapid meaning that heartbeat is going a lot faster. Sometimes you can even see it in their neck, but it's not very forceful, okay? Like it's beating a lot, but instead of pushing the blood out like it should, it's kind of just trickling out, okay? They could be cold and clammy. Okay, they can be sweating. Turning blue is a big one. Okay, definitely a big one to look for is the increased unconsciousness. Usually with people with shock, they will start to lose consciousness. They'll be starting to become unresponsive. Some symptoms of shock: nausea. They'll feel sick to their stomach. Oftentimes they say that they are thirsty. However, you do not want to give them anything to eat or drink. All right. Some other symptoms: dizziness, drowsiness, and feeling sluggish. Okay. With shock, your body is starting to shut down, so everything is just kind of slowly turning off. So what are we gonna do? Okay. Um, the first thing that you're going to do to treat shock is figure out why they are going into shock. If it is a blood loss situation, then taking care of that wound is going to be number one priority. If it's the heart is not functioning, it's getting that heart to function again, okay? Because you have to figure out why they're going into shock to begin with, all right? Keeping the athlete warm is going to be a big one. Our blood flows smoother when we are warm. Okay. Sometimes you'll see like marathon runners and stuff, or triathlons, and then when they're finished, they wrap them in the foil, or a little foil blanket. That's kind of the same purpose behind this. Okay. You want to elevate the legs 10 to 12 inches above the heart, only if you do not suspect that there is a fracture. All right. Remember, we've been talking about if you move a fracture, what could be nice and relatively okay could end up on top of itself and ending up with a different type of injury. Okay. You do want to keep an eye on their breathing rate and their heart rate, making sure that everything is looking relatively normal. Okay. Make sure that they are still breathing and they do still have a pulse. You do not want to give them anything to eat or drink. Okay. You don't want to put anything else in their body when their body isn't going into shutdown mode. All right. If you have the victim laying down, you want to make sure that you have them on the side, laying on their side. So if they throw up, it doesn't get stuck in their throat, and then they have other problems as well. Okay, that's it on shock. Okay, we do have a little handout. I'm going to quickly show you that talks a little bit about the different types of shock. All right. Lots of different, oh, where'd it go? Lots of different causes for shock. The first one that we see is psychogenic, and that's going to be where the patient has fainted. Okay, lots of different reasons why they would faint. The second one is septic, and that's going to be usually from an infection inside your body. Okay, sometimes you guys will hear that somebody has turned septic. All right. The third kind that we have here on the chart is neurological. All right, and you're mainly going to see those if you have a brain spinal related injury. Okay, and that would be something that we would deal with in sports medicine. Cardiogenic, dealing with heart. Okay, so when our heart stops, we end up going into shock. Hemorrhaging, if we have internal blood loss, all right, it's going to be another reason why we would go into shock. Metabolic is going to be something like another condition like having diabetes. We have respiratory, having some issues with breathing. Okay. And then the last one is going to be anaphylaxis, which is an allergic reaction. So having that allergic reaction could lead to shock. Okay. Just keep in mind that there are several different reasons why we would go into shock, but you need to know how we are going to take care of it. Okay. That's the end of secondary assessment. We will test on Monday. Thanks, guys.